This is BBC Radio Leicester at 22:11. Good morning. I'm Naomi Kent in for Ben Jackson. Now, October is Breast Cancer Awareness Month, and as my mum had her own battle with breast cancer 12 years ago, it is something that I personally think talking about is very important. So joining me today is Deb Harrison from Leicester, who has undergone a breast reconstruction operation in 2014 following the disease. She's also the lead volunteer at Leicester Royal Infirmary for one of the biggest support groups in the country. Also with me in the studio is one of the consultant plastic and reconstructive surgeons at the LRI, Nakul Patel, and Megan Sweeney, who is a plastic specialist nurse. What a team! Good morning, folks.
Good morning.
So I'll start with you, Deb, if you don't mind. Tell me a bit about your story and what you have kind of been through.
Well, I had a horrible letter when you're 50. Happy birthday being 50 and get your first mammogram. Went no problem, never thought no more about it. Got the call back. Within 6 weeks I'd had a mastectomy, reconstruction. Bit of a whirlwind.
Yeah, I can imagine, particularly with that, because I know when my mum had it, she had found not a lump, but she'd found the indentation, and so that then meant that that at least she had a symptom, so she had an idea that maybe when she was going for the mammogram there might be something wrong. Whereas when it's the routine one, I suppose you're not really thinking, you're just thinking, well, this is a routine procedure. Yeah. So then what? And
like I say, it just whirlwind from there. It was biopsies and appointments and more biopsies. But the staff were brilliant. My consultant was brilliant. She talked me through it, sort of guided me through it, which without her I don't think I'd have coped. but I did.
Was this at Glenfield?
Yes.
Yeah, my mum was there too.
And like I say, it was amazing that it all happened so quick. You don't have time to think about it. It's just, you know, like you're there and you're doing it.
Yeah.
You've got no choice. It's got to be done, so you just get on with it.
Yeah.
It's later that it starts playing with your head afterwards once you've, you know, sort of got that all clear. Yes, you're cancer-free, you'll go out there and live your life, and that's when it sort of bumps.
Yeah.
You know, it's like that's when reality sets in, sort of afterwards, I think.
And so at what point for you was reconstruction kind of a thing that was on the table? Was that from diagnosis?
From diagnosis, okay. Yeah. So I had mastectomy, immediate construction. So it was all in one op.
See, that's interesting because I mentioned to you with my mum, she didn't have the reconstructive because she got to have radiotherapy and the chemo afterwards. And so because of the radiotherapy, I think that means that they can't do the reconstruction at the same time. Is that right?
Things have moved on a little.
Okay.
Yeah. So historically, we would be concerned about doing things at the same time. But actually now, with some of the advances in technology, certainly these things can be done at the same time. And we often offer patients the options that are going to be best if they have had radiotherapy.
Yeah, because I think that was the thing that put my mum off having it done. I think maybe she would have had it if it could have been in one go, but the thought of going through the mastectomy operation, then months of chemotherapy, then months of radiotherapy, to then go back into hospital for another operation.
That's understandable.
It can kind of put them off. But so presumably you had your reconstructive surgery and it all went well?
It did.
And now this is where we get to the sciencey bit. So Nakul, please can you explain how it works?
Yes, well, there are many options for breast reconstruction. You can think of them in a few different ways. You can either use implants to reconstruct a breast, much like this one I've brought in.
I know you. Can I have a hold?
Of course.
Ooh. It feels like it almost feels like a stress. You know, you get those stress relieving things. It feels quite nice.
I didn't want to let you know, but sometimes they are used as that. And then if you're not going to go down the implant route, you can use your own tissue. And we can take tissue from various bits of the body. A common site for us to take it from is the tummy tissue. So it's not the same, but it's almost like taking the excess tissue that we would do, say, for a tummy tuck, but using that as a transplanted part of tissue and connecting it to some blood vessels in the chest. Other options, like Deb's had, is using your back muscle and skin. And then with that, sometimes we add a small implant just to give the additional volume. And then there are patients like your mother that might go down the route of not having a reconstruction, but even years later might come and see us just to have something done.
Yeah. And so, Megan, where do you kind of slot into the procedure?
Obviously, so we see patients in a breast recon clinic. So
Yeah.
sometimes that's after patients have had diagnosis of breast cancer. That's a clinic we do like twice a month with the likes of Mr. Patel and our oncoplastic surgeons. And we obviously go through options of reconstruction with patients, offer various different bits of information. I've got an information pack I could show you. And then we also talk about the support group. So ladies that have had diagnosis and not sure about what option of reconstruction that they might have, might want to come and speak to a patient like Deb, just to get a patient's perspective and sometimes have a look at reconstruction, because we do something called show and see. So they get to, in a private coordinated manner at the group, they get to have a look at the reconstruction options, because sometimes in the flesh some patients think that's better than looking at a picture.
Yeah.
Not for everybody, but
Yeah.
it does. A lot of ladies do like that, and then they can sometimes make a decision off the back of that. So ours is a lot of guidance support, on the phone to patients, email patients. We see patients a lot on the ward after they've had the reconstruction, so I give them the pamper packs that Deb puts together. So this is a lot of like just a little pick me up after they've had the surgery. And then we also follow the ladies right through to after they've had the reconstruction, do the wound checks, and then later on, if ladies want to, the nipple tattooing, where they have the colour on for the areola. So we probably see the ladies probably right from the start, really, right
Yeah.
through to the 5 years down the line
Like
at the groups. Yeah.
holding their hand through the whole journey. Now, I want to talk to you actually a little bit about the support group, Keeping Abreast. What a great name. But I'm going to play a song first and then we'll catch up after this. So it's BBC Radio Leicester, 12 minutes to 11. The Emotions and the Best of My Love, 9 minutes to 11. It's BBC Radio Leicester. Naomi Ken in for Ben Jackson. And as it is Breast Cancer Awareness Month, we are talking breast cancer and reconstructive surgery with Deb Harrison, who has undergone the surgery, Nakul Patel, who is a surgeon, and Megan Sweeney, who is one of the plastic specialist nurses. Thanks so much for joining us, folks. So you were talking about the support group, Keeping Abreast. So Deb, fill me in. What can someone expect if they're coming to this support group?
We find that a lot of the ladies are very, very nervous. Some we have to fetch in from the car park. But once they're in the door, it's like a big family. You know, we all it's just, you think, oh, there's that many people here, how are we going to deal with them all? But they just break off into small groups and just discuss things, what's on their minds, which really, really helps people. Things that you wouldn't say to your surgeon or your family or to anybody else. It's just those things that are in your head you can say there, because we've all thought it, and we've all been there, and we've all got the answers. The show and see really takes off.
Excuse the pun.
really does.
We certainly have patients that come back to clinic and say that was the most valuable part of their journey, seeing other patients.
Yeah, we have ladies that just come to the show and see and then go. You know, because in the books it doesn't show the true reality of how it's going to be.
And like you said, when you were kind of given the options of, here are the types of reconstructive surgery that you can have, when you're in that whirlwind moment, then making the decision must be really kind of, well, I don't know.
That's it. And am I making the right one once you've made it? That's hard as well. You know, you think, well, should I choose the other one? You know, should I choose something different? Where the group, we cover most surgeries now. I think we cover all the surgeries now. So there's always somebody there that you can have one-to-one and talk to just on one-to-one, or in the groups, which get quite loud, don't they? But that's the way we deal with it. We do, we don't want them coming in and being scared. We want them to be relaxed, so they do take in what's being said, what's being shown.
Yeah.
And it really does help.
Yeah, and like you say, everyone's friends, everyone's kind of been through or going through or potentially going to go
That's
through a
right,
similar
yeah.
thing. So it's like
we're like a little family now.
Yeah. Oh, amazing. So Nakul, you were saying that you wanted to talk a bit more about the is it the reconstructive?
Yes.
Yeah.
Well, I still find it staggering that 75% of patients still don't know all their reconstructive options. So here in Leicester, we try and run a joint breast reconstruction clinic where we have nurse specialists, breast surgeons and plastic surgeons, so that patients are offered all the available options and they can make a good informed choice as to what's going to be right for them at this stage in their life, rather than just being given a limited choice or no choice at all.
And how, so if somebody now is going, oh, I didn't know I had the option of that, and actually I might like to consider the option of that, how can you find out about where those things are, when they happen?
Yeah, so a couple of options. So, for example, for your mother, it's been some years. She can either just see her GP, get a referral letter, come and see us. If she wants to do things a little more informally, then she can attend the Keeping a Breast support group through Debbie and Megan, and then our nurse specialists are always there as well to help. And really, we couldn't run this service without this sort of efficient team, and we cover all bases for the patient.
Oh, I feel like you're a great team, the three of you. So the Keeping a Breast support group, when does that happen?
We do every other month,
Yeah.
which our next one is the 4th of November.
Yeah.
Okay.
So
It's a Monday evening, isn't it?
Yeah.
So it's normally the first Monday of that second month. And on the Keeping a Breast website, as one of the groups, we've got a section for Leicester, and that gives you the upcoming dates and things that we have covered in the groups in the past.
Brilliant. So what is the website?
Keeping a Breast
Leicester,
isn't it?
Yeah.
.co.uk.
Yeah.
Perfect. Amazing. Well, thank you all so much for coming and talking so openly and honestly about everything. And hopefully, if it helps one person, what a win. So, Deb, Nakul, Megan, thank you for joining us today.
Thank
you.
you for having us.